Okay, next morning, everyone.
Next morning.
Tonight we're going to talk about sex. Right? The topic of does glutathione affect sexual health? This will be the contents of tonight's talk. What is glutathione? What are the major functions of glutathione? And then we will go through on the male and female sexual health, and then the role of glutathione in sexual health. Then what happens to the glutathione levels with aging? And finally, the best way to boost your glutathione levels. Okay, a revision to everyone who have been following the series of lectures. This is the glutathione molecule, and the chemical short form for the active or reduced form of glutathione is GSH. And glutathione is made of 3 amino acids: glutamic acid, cysteine, and glycine. So it's a tripeptide. It has many functions crucial for health. And remember the GSH, the G refers to the bulk of the molecule, whereas the SH refers to that part, the sulfur atom, the yellow color there, and the hydrogen atom attached to it. So that's called the thiol or sulfur hydride group. That refers to the SH. So why is it that the bulk of the molecule is G, and then these 2 atoms have special attention? Is because it is this SH group that gives glutathione its versatility, but unfortunately, it also is also what makes glutathione fragile. Right? The glutathione molecule is fragile. Okay. And for decades, glutathione has been known as the master antioxidant. Here, Dr. Oz calls it the superhero of antioxidants. And the reason is that it is the most important intracellular antioxidant, meaning it's the most important antioxidant for your cells, which means it's the most important antioxidant for your organs, which means it is the most important antioxidant for your body. So what are the major functions of glutathione? We know it is the most important intracellular antioxidant, but then since then we also know that it's a powerful and versatile anti-inflammatory agent, a very powerful immune booster and modulator, a powerful and versatile detoxifying agent, and the science now moving towards signaling molecules, and glutathione is also a powerful and versatile signaling molecule to many cell systems. But besides these major functions, there are hundreds of other functions of glutathione. So because of this, then it is not surprising that if studies have shown that having low levels of glutathione is associated with higher risk of diseases. Several clinical case control studies have shown that patients under chronic disease states, such as heart disease, stroke, arthritis, diabetes, and malignancies, have lower plasma levels of glutathione than control subjects, suggesting that glutathione has a protective role against such diseases. In fact, more than 100 diseases have been studied and shown to be associated with having low levels of glutathione. Conversely, having high levels of glutathione is associated with good health and longevity. And research shows that glutathione may prolong your life. So it's not just a blind claim, it's backed up by scientific studies. Studies clearly show a correlation between high levels of glutathione activity and longevity. The first study in 1998 showed higher levels of active glutathione in centenarians as compared to those who were 60 to 79 years of age. Okay, so meaning those who were living at 100 and 105, between 100 and 105 years old, they were having same or higher levels of glutathione than people 30 to 40 years younger than them, right? 20 to 40 years younger than them, right? So that's a very important point to take note. And then 4 years later, another study. Now this is a prospective study because they followed these 87 healthy women aged 60 to 103. They followed for 5 years, and they found that those with high levels of glutathione were the ones who lived longer, right? Who didn't die or who didn't get sick. Okay, so that's a general introduction on what is glutathione, what are its major functions, and the application of having high levels and low levels of glutathione. Now let's zoom into sexual health. But first, we need to know the difference between the male sexual health and female sexual health. What are we looking at, right? Okay, when we look at libido, right? Hormones are the main determinant of your libido, your sexual desire. Then we look at the sexual function in men. Men's sexual function is very, very complicated. You need to have a healthy heart. You have to have healthy blood vessels. Then you have to have fitness and stamina. Then you have to have a healthy penis. Then you have to have the ability to have good erections, that is grade 3 and 4. I will explain more later. And you need to have healthy prostate. So very complicated. All right, when it comes to fertility, again, you need good erection and you must have sufficient healthy sperm. When it comes to women, libido, same thing. Hormones are the determinant of libido. Then when it comes to sexual function, don't forget, right, the breasts are also considered as sexual organs. Now, of course, you have healthy breasts, healthy vulva and vagina. And then for fertility, then you need to have the healthy internal organs, a healthy uterus, healthy fallopian tubes, then healthy ovulating ovaries, and of course, the healthy eggs. Okay, and for women, it doesn't stop there. They also have to become pregnant. So for pregnancy to be successful, there must be good overall health also, because for talking about sex, then all the above applies, sex and fertility. But when you talk about pregnancy, every other organ has to come in, right? So the woman needs to be overall healthy in terms of heart health, lung health, kidney health, liver health, etc., etc. Okay, but the largest sexual organ in both male and female is the brain. Okay, and there's distinct difference between the male brain and the female brain, what they're thinking all the time. Okay. Okay, so let's talk more about the male first, then we go to the female. Okay, first with libido, and with low libido, especially if coupled with the erectile dysfunction, then not just the man suffers, the partner suffers. Okay, because the sexual act requires the man to be able to perform. Whereas as far as the sexual act goes, the woman can even be asleep and the act can happen. Okay, so most of the time the problem is with the man in the erection part. But for some, libido is also a problem, especially when they start getting older and the testosterone goes down, then libido becomes an issue. For the women, most of the time, it is a problem of libido, especially after menopause, because the estrogens are very low and the testosterone also go down. So the point is, we have low libido, and if there's erection dysfunction in the men, both partners suffer, right? Not just one person. So let's look at libido. When it comes to libido, the same formula applies for men and women. These are the hormones that are important. right? Androgens, right? The testosterone, you know, the men talk about testosterone, but testosterone is also important for libido in women. In fact, when my female patients have problems with libido, right, after making sure that she has sufficient estradiol, I top up her testosterone, the male sex hormone. But of course, in much lower doses than what we do for men. We don't want them to grow mustache and beards, right? But it is testosterone, which is also the main libido boosting hormone in women. But they need to have a healthy level of estrogens first to make sure that they don't become too androgenized, meaning become like a man. Okay. Then estrogens, the men only need a low level of estrogen to provide the balance, but the woman, of course, need higher levels of estrogens. And estradiol is the main type of estrogen. There are three human estrogens, estrone, estradiol, and estriol. The main hormone is estradiol. And then you have human growth hormone, HGH, which is the main hormone that anti-aging doctors talk about. But on the other hand, it plays also a very important part in libido and sexual health. And then the fourth hormone is DHEA, a very long name, dehydroepiandrosterone. You remember DHEA. This hormone is usually neglected by most doctors, but anti-aging doctors pay a lot of attention on this, and we see a lot of impact and improvement in our patients when we top up the DHEA. Okay. Of course, you know, all the hormones in the world cannot make you still wanting to have good sex, because you also need a stimulus, right? Sexy stuff can trigger arousal, and it helps to have a sexy partner. Okay, sometimes all the hormones in the world, but your partner, you know, turns you off, so susah. Okay, so the question is, do hormones determine whether you are straight or LGBTQIA+? You see, right? Started with just LGBT, then add Q, get I, add A, right? What does all that mean? It means lesbian, gay, bisexual, transgender, queer, intersex, asexual, and more, right? More and more funny types are coming out. So do hormones determine whether you are straight or this? The answer is no. Okay, the answer is no, right? So the hormones do not determine, but does not mean that the hormones do not play a role, right? It is on how your brain works, blah, 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 blah. Then the hormones have a role. Okay, most of the macho men can either be straight, can either be gay, either be bisexual, right? The hormones may be the same between the three of them, but how these hormones influence the brain and their psychology is a different matter. It's very complicated. Okay. What we know is that glutathione improves the testosterone system. Glutathione does not increase the testosterone level, but improve the functioning of the testosterone system. How? Okay, first, testosterone is produced by the testicles in response to trophic hormones. I mean, trophic hormones means hormones from the brain that instruct the testicles to work, right? So when it comes to the sexual function, the two main hormones, LH and FSH. So LH is the one that is involved in testosterone production, whereas FSH is involved in sperm production, but they are in tandem. Okay, so when in the normal healthy man, it goes together. While the sperm are being produced, then the testosterone is also being produced. Testosterone increases libido and improves health, right? It is important for heart health, muscle health, bone health, blood health, of course, sexual health, and more. So it's not just about sex. That testosterone is very important head to toe for men. testosterone production is directly related to sperm production. As I mentioned earlier on, these two trophic hormones are produced by the brain and they work parallel together. Glutathione protects the free or active circulating testosterone and the testosterone receptors on the cells from harmful and toxic impurities so that they can function effectively. Right? So overall, glutathione makes testosterone function better. Okay? So it protects the hormone itself, it protects the receptors, so you have pristine testosterone, and you have fully functioning receptors for the testosterone to lock on, so you get excellent function. And the strongest natural method of boosting testosterone is intense exercise. All right, you can do intense sprinting, weightlifting, wood chopping. Okay, which means if you want to maintain a high testosterone as you age, then you must maintain your muscles. Yeah, you must maintain your muscle. I remember I had a 70-year-old patient who was brought by his friend who were my patients who were on testosterone therapy. But even when he came, I could see that he was muscular. Okay, so I did his blood test, and it turned out he was 70 years old, but his testosterone level is at the top, the same as men, young men in their 20s. So I told him, I said, Dato, you don't need testosterone therapy. You're already flush with testosterone. So he was so disappointed because all his friends were talking about, coming for testosterone jabs. I said, but you don't need it. Right? So it's important to build muscle, to maintain muscles, if you want to maintain your testosterone levels naturally. What else do we know? We know that glutathione improves functions of most hormones, not just testosterone. Okay, and I've given an example how glutathione improves the testosterone system, but almost the same way we know how testosterone improves the insulin system for diabetics. Okay, because all the hormones require intact, healthy receptors on the target cells for their instructions to be fully recognized and implemented. Example, healthy insulin receptors are required for proper glucose utilization by the cells, and the damaged receptors is what cause insulin resistance. Glutathione helps keep all hormone receptors healthy by protecting them from damage by free radicals, toxins, inflammation, and infections, through also improving the immune system. So all the hormone systems involved in sexual health, the androgens, the estrogens, growth hormone, and DHEA will benefit from glutathione. Next, remember, for men, for the sexual act, especially, the man needs healthy hearts and blood vessels. So how does glutathione protect the heart and blood vessels? Okay, we know there are many risk factors for heart disease, right? And for most of these, glutathione can help. Okay, so I won't go into detail because this is not a talk on heart health, but just to remind you that glutathione can make your heart healthier in many ways. Okay, all these many are improved by glutathione. Okay, some of the things we know that of the many risk factors, among the most important are inflammation and the oxidation of bad cholesterol. And we know that glutathione can reduce inflammation and can help prevent the oxidation of bad cholesterol. And glutathione also helps maintain normal blood pressure, helps protect from the damage of diabetes, and helps in detoxifying the toxins of smoking and the oxidative stress caused by smoking. Okay, and we know that glutathione helps the liver to produce normal levels of cholesterol. We know glutathione improves the nitric oxide production, and nitric oxide is very important to keep the blood vessels open. And even the basic function of the red blood cell, which is to deliver oxygen is also improved by glutathione. Okay, now we zoom to the male reproductive system. In case some of you may not be familiar, even some of the men also don't know what their body parts are doing. I remember way back when I was still a medical student, one of my late father's friends, after hearing me explaining something to my parents, has to be there, he said, "Oh," he said, "oh, so our testes produce our sperm, yeah?" And he has about 7 children. You see? So it's good to know what all these parts are. At least you know when I talk about the penis, what it is. When I talk about the testicle, what it is. When I talk about the prostate, what it is and where it is. Okay? People know about the testis and the penis, but many are probably not so certain about the correct exact location of the prostate, and many don't even know what is the seminal vesicle. Okay. So how to maintain healthy penis? See, the penis, to be healthy, all the 3 components need to be healthy. First, you have to have healthy blood vessels. As you know, erection is about blood vessel. It's about engorging the penis with blood. So for that, must make sure there's no blockage, no atherosclerosis, and no plaques. So what happens in the blood vessel, the penis, is the same thing that happens in your coronary arteries. The thing is, the blood vessels of the penis are smaller than the blood vessels, their coronary arteries even. So the symptoms will appear in the penis first. All right, before you had heart attack, your penis will go dead first. So apart from no blockage, then you must have the ability to dilate on demand. Right? So when you're excited, then you should be able to dilate and let the blood in. This is where you need testosterone, you need nitric oxide, and of course, no blockage. Because there is blockage, then the blood cannot rush in. Next, the sponge needs to be healthy. You know that there's no bone in the kidneys. When the man has a heart erection, it's not because of suddenly there's a bone there. It's just purely the sponge is fully engorged and becomes hard. So for that to happen, there must not be fat infiltration. If you ask men who knows biology, okay, what is the penis made of? They say, "Oh, I know it's a sponge." That statement is only true for those men who have sufficient testosterone. As the man grows older and the testosterone levels go down, then slowly the sponge is being filled up by fat. So many of the older men are not walking around with a healthy, spongy penis. They are walking around with a fatty sausage in between their legs. When that happens, even if the blood is pumped in, the blood cannot go and fill up the sponge because the sponge is all filled up by fat already. Okay, so that's why in those cases, even double dose of Viagra will fail, right? Because there's no space in the sponge, all filled up by fat. Fortunately, it is reversible, meaning we can restore the state of the healthy sponge by restoring the high levels of testosterone like in a young person. Thirdly, there must be healthy nerve supply in the penis. And again, just like the healthy sponge depends on having sufficient testosterone, healthy nerve supply to the penis depends on having sufficient level of testosterone. Okay, and like the fatty fat infiltrated sponge, which is reversible by restoring the testosterone level, right? The the poor innervation of the penis that happens due to prolonged low level of testosterone is reversible, right? Nerves will start growing again the moment you start raising the testosterone level. Okay, so we're talking about testosterone, but note, glutathione has a role here. It improves testosterone function, it improves nitric oxide production, and it helps prevent atherosclerosis. Okay, so glutathione has an important role to help in the function of the penis. Nitric oxide is a gas actually, right? It's required for vasodilation and most relevant in the heart and penis, all right? The heart is the coronary artery, in the penis, right, is the penile artery. Glutathione is an essential cofactor for the enzyme nitric oxide synthase that synthesizes nitric oxide from L-arginine, which is an amino acid. So you see, glutathione is a crucial requirement in our production of nitric oxide. Glutathione is significantly reduced in those who have erectile dysfunction plus diabetes compared to those who have erectile dysfunction but no diabetes, right? So you can see those with diabetes, you know, their glutathione level is really bad. Those without diabetes, also with erectile dysfunction, their glutathione level is low, but those who have both erectile dysfunction and diabetes is even lower. And glutathione has a negative correlation with fasting blood glucose, right? For those with diabetes, the higher your blood glucose, you can expect lower levels of glutathione. Okay, now time to explain the grades, erection grades. When earlier on I said, okay, you must have at least grade 3 and 4 for sex. Okay, officially in the medical grading, there are 4 grades. Grade 1, the penis swells up but not erect. Grade 2, erect but not hard, so still cannot have penetrative sex. Grade 3, it's hard enough to penetrate, but not the best. Grade 4 is a good erection, described as an unpeeled banana. However, I am not satisfied with this official grading, so Dr. Ahmed's grading has 6 grades. I add 2 more grades. There's grade 0, which is dead, right? So some penises are dead, right? You put 10 naked women in front of them also, they are dead. Okay? And grade 4 is not enough. Unpeeled banana is nothing. There are young men going around, young men especially, and a few older men who are on testosterone injections of high doses and taking nitric oxide high dose supplements. The erection is not unpeeled banana, but iron rod hard. Okay, so this is my grading. The official is only 1, 2, 3, 4. Right? My grading includes 0 and 5. Okay. Big question to the ladies: what is your men's grade? Okay. Afterwards, you want prizes? You can answer this. Okay. The bad story about those with diabetes, right? This was a study in Australia, where they studied men from 18 to 59. And they found that almost one third, 31% of males have some degree of erectile dysfunction. You know, it's so young. But yes, I remember I had a 25-year-old guy who just came back from Middle East, working in the Middle East, and the wife was pushing their baby. But they came to see me because the husband said suddenly he's just not interested in sex and cannot perform, blah, blah, blah. He was only 20-something, 25, maybe 1 or 2 years older than that. So fortunately, I reminded myself, don't assume he's 25, 26, 27, that he has sufficient testosterone. Do the test. When I did the test, I was shocked because his level was that of an 80-year-old. Okay, so fortunately, we know the problem. We could help. He was not diabetic. But anyway, this is a story about diabetics. So in general, these are rough guides. Among those who are above 30, there's already at least 20% with some degree of erectile dysfunction. Sometimes it could be some chronic disease. Sometimes it's just poor health. There's so many people, young people now, poor health, obese, not exercising, smoking. Then 40 and above, it rises up to 40% have problems. But if they are chronic diabetics, it is 75%. And 50 and above, the rate of erectile dysfunction increases to more than 60%, but for diabetics, it's more than 90%, right? And many men who have ED would develop depression and have low self-esteem. But thank God for Viagra and its clones. This was an old newspaper cutting from 20, just after 20. Ada dates juga. Too small. November 5, 2001. You can see, yeah, November 5. Okay. Viagra sales in Malaysia 3 billion at that time. And we, Malaysian men, #1 Viagra users in the world. Okay. We are the world champions. What does it tell you? It tells you that Viagra, Malaysian men have ED as a major problem. Otherwise, you won't be wasting money buying Viagra. I can talk a little bit about prostatic health. So benign prostatic hyperplasia or benign prostatic hypertrophy is a common problem. Etiology is not well understood. Inflammatory mediators, inflammatory genes, hormones, dietary factors, and oxidative stress have been implicated in the development of benign prostatic hyperplasia. There are significantly increased levels of oxidative stress and DNA damage, and decreased levels of antioxidant enzymes and glutathione in BPH patients. Again, you see, yeah, glutathione is a major factor in BPH. Prostatic tissue damage and oxidative stress may lead to compensatory cellular proliferation with resulting hyperplastic growth. It is possible that BPH represents an alternate non-malignant pathway of unregulated prostatic growth promoted by oxidative stress, inflammatory mediators, and other factors. Right? This is what they're saying, that maybe it is a result of oxidative stress, inflammation, and other factors. That's why it grows big as a reaction. Free radicals play a role in carcinogenesis. Now we talk about cancer also. And that BPH, right, benign prostatic hyperplasia or hypertrophy, should be considered as a pre-malignant condition, which may evolve into prostate cancer. High oxidative stress parameters and low antioxidant activity are more prominent in prostate cancer patients compared with BPH and controls. Okay, so worse still, those with cancer, then their levels of antioxidants and the level are low, and the level of oxidative stress are high. So there is potential role of antioxidant, especially glutathione, in preventing BPH and in preventing the progression to prostate cancer. Okay, so don't underestimate the importance of glutathione in sexual health for the male. Right, we've heard so many things, and prostate enlargement is a major thing, and prostate cancer also have now affecting many people and also killing also many people. So the studies have shown we are not making unfounded claims. I'm quoting studies that shows that antioxidants, especially glutathione, may have a role in helping prevent prostate enlargement and its progression to prostate cancer. Oxidative stress and inflammation are associated with prostate cancer development and progression. Declining levels of glutathione in prostate cells with aging may contribute to prostate problems, including prostatitis, BPH, and cancer of prostate. And glutathione and other antioxidants have clearer roles in reducing the risk of developing prostate cancer, that is prevention, than in trying to reverse it. Okay, so we know this, like with other cancers also, prevention, the role of glutathione is clear. But when it comes to already, when there's already cancer, then we are always in a dilemma, because then the cancer may use the glutathione to become resistant to treatments, and worse still, the cancer may use glutathione to survive and spread. So let's focus on prevention, right? While you're still healthy, when you know the risk of men, older men, the risk of getting BPH and prostate cancer is definitely there. Make sure you have plenty of glutathione to protect yourself. Okay, prevention is better and easier than cure. Okay, lastly, male fertility. Lastly for the men, yeah, not lastly for everybody. Glutathione and male fertility, we know glutathione improves sperm quantity and quality. Glutathione helps improve sperm quantity and quality, that is, the form and function, especially motility and the ability to fertilize eggs. Hundreds of millions of sperm are produced daily in the healthy, sexually active male. Sperm production and quality are affected by genes, hormones, nutrition, toxins, free radicals, and infection. And glutathione can help improve most of these factors. Okay, now we come to the female. So a reminder, you know, of the different aspects in male and female, right? I've already mentioned when it comes to libido, it's still hormones, right? So we can give a pass on that. So we zoom into the reproductive organs. Glutathione helps maintain the health of the breast and the vulva and the internal organs, the vagina, uterus, fallopian tubes, and ovaries. Okay, so just the diagram there to familiarize yourself what I'm talking about. Right, the lower part is the vagina, and then the upper part is the uterus, and then the entry to the uterus is the cervix. Okay, then you have the tubes called the fallopian tubes leading to the ovaries, which produces the eggs. Okay. So the common problems are menstrual problems, and then you have PCOS, which stands for polycystic ovary syndrome, very common, right? In some countries, there's say 40 to 50% of women, the premenopausal women have PCOS. Then you have fibroids, right? 20 to 30% have. Endometriosis, maybe 10 to 20% or even higher have. Glutathione may help improve all of this and may also help in prevention too. So just like in the men, glutathione has a very important role in helping maintain female sexual health. Okay, and it is known that glutathione can really help those with PCOS, right? So how does it do this? So, you know, for those who know about the polycystic ovary syndrome, they are usually infertile, they are usually overweight or even obese, okay? And they have a tendency to have excess male features, all right? They tend to have a mustache, okay? Because of the problem inside there. Insulin resistance has been implicated. Just as in diabetes, insulin resistance is has been implicated as a major factor in PCOS. And now the research are showing that elevated glutathione levels in the cells result in insulin binding to the carrier proteins, which helps glucose uptake utilization and lead to decrease in insulin levels, and thus alleviates the leading cause of PCOS. Okay, first they discovered that elevated levels of insulin is the leading cause of PCOS. Now, research has shown if you boost up your glutathione level, you can reverse that. Okay. What about female fertility? Toxins, free radicals may damage the eggs and affect the quality of the developing fetus. Glutathione protects the harmful effects of toxins, protects against the harmful effects of toxins and free radicals, which end up in healthier eggs, which will end up in healthier pregnancies. So in the man, it makes the sperm healthy. In the women, it makes the eggs healthy. So you have healthier babies. And don't forget, by helping to prevent or reverse PCOS, fibroids, and endometriosis, which are major causes of infertility, of course, right? Glutathione improves fertility. So directly and indirectly. So that's the summary. Of course, I need to remind, for the woman doesn't end up here. The next one is pregnancy. For pregnancy, all the organs need to be healthy, and glutathione helps keep all the organs healthy. In fact, when we go into some diseases of pregnancy, also now the science of glutathione is coming in, you know, too late. I've already retired as an obstetrician. I wish I knew all this before. I would have been using glutathione every day in my practice before, but never mind. Hopefully the current obstetricians will keep up with the science of glutathione and start using glutathione in the practice. Okay. So we know the importance of glutathione in male and female sexual health. Now let's see what happens as we age. Okay, as we age, unfortunately, as part of our aging, our programmed aging, our glutathione levels decline by about 10 to 15% every decade. So then slowly and slowly you have excess free radicals, and you have higher levels of oxidative stress. Then you have higher levels of inflammation, you will have higher levels of toxins, and you have lower level of immunity, and you have lower levels of signaling molecules, because all those are related to glutathione function. And certainly, all that also will affect your sexual health. So how to increase our glutathione levels? We need to know that glutathione taken orally is not well absorbed, and the best way to therefore increase glutathione is to supplement with glutathione precursors. What do we mean by glutathione precursors? Precursors are the 3 amino acids that make up glutathione. Remember, glutamic acid, cysteine, and glycine. So glutamic acid and glycine are usually plentiful in our diet. It is cysteine that is difficult to find in a diet. And also cysteine is fragile because it is the amino acid that carries that thiol group. Remember, I told you that part that makes glutathione fragile? It is the cysteine. So the thiol is fragile. Cysteine is also fragile. If you cook, then it becomes denatured. So the most important precursor is cysteine. So the challenge is to provide cysteine in a stable form that can be absorbed and be made available for our cell to make ribosine, right? And the best source of stable cysteine in the market right now is ribosine. So what is ribosine? Ribosine is a patented nutrient from the research of this company, Max International. It is actually made of 2 natural components, D-ribose, which is a simple sugar, and L-cysteine, which is a natural amino acid. So the full chemical name of ribosine is D-ribose L-cysteine, shortened to ribocysteine and trademarked by this company as ribosine. Okay, so that's what all the 3 terms mean. So cysteine is now stable and easily absorbed and utilized by the body to make glutathione. Then the ribose, which is a sugar used to stabilize the cysteine, then it's not just useless. It is not not burned up to make energy, but it is used by the body to make ATP, which is the energy-carrying molecule. And with extra ATP, then the glutathione synthesis is also enhanced, because to make glutathione, you require ATP. All right, so it's just like you buy a toy with a battery provided. Here you have a nutrient, you have the glutathione precursor, right? The L-cysteine with its battery provided. ATP is its battery to charge the glutathione synthesis that is really involved in. So which probably explains why ribosine is 300% better than the next best glutathione precursor, which is NAC. Okay, and by comparison, weight for weight, yeah. So research had shown that NAC is 8 times more efficient than whey protein. Whey protein is a collection of many amino acids, including the glutathione precursors. So NAC is 8 times more efficient than whey protein, and ribosine is 3 times more efficient. So ribosine is 24 to 25 times actually more efficient than whey protein. So we have 2 ribosine-based products. We have Max1, which is 100% ribosine. And then we have Salgevity, which is ribosine plus 12 other ingredients that have many other health benefits, plus also enhance the glutathione function. Okay, so Salgevity is an anti-aging powerhouse. And in the recommended dose of Salgevity, you get the same amount of ribosine as in Max1, right? Plus 12 other. Okay, conclusion. Glutathione is very important for sexual health. So push your glutathione level now. Thank you very much.